Good morning, everyone. Hope you're all having a good morning so far. Thank you so much for joining us for this webinar today. I'm going to get us started. My name is Elise Willis. I'm going to be hosting us today. So I want to welcome you all to Canopy's webinar, Bridging Trees and Health, the Public Health Outcomes of Urban Tree Canopy. Canopy is an urban forestry nonprofit that plants and cares for trees throughout the Mid-Peninsula and is hosting this webinar series to offer guidance from Bay Area experts on ways to ensure resilient urban forests by providing useful tools and information to decision makers. So we've got some wonderful speakers here with us today. I'd like to introduce you to Dr. Desiree Backman, who is the director, and Dr. Neal Kohatsu, the chief health strategist of the Population Health Group within the Center for Healthcare Policy and Research at the University of California, Davis. And Ray Tretheway is the founder and former executive director of the Sacramento Tree Foundation. So before our wonderful speakers take it away, I have a few notes for you all. So for technical support this morning, please send a message in the chat, which you can find at the bottom of your screen. And Natalie Brubaker, Canopy's education director, will help you out there. And any questions that you have for speakers throughout the morning, please put those in the Q&A, which you can also find at the bottom of your screen. And I will be monitoring that throughout the morning. And some questions may not be answered today, even though we have a wonderful amount of time at the end for question and answers with our speakers. Anytime, if we do run out of time, we will add unanswered questions with answers to Canopy's website at the end of this webinar. Just a reminder that this webinar will be recorded and uploaded to the Canopy webpage, along with the recordings from our past webinars. Following the webinar, you will be prompted to fill out a survey, and we thank you in advance for any feedback you can give us. And for those of you who are ISA certified arborists, you will receive the CEU code for the webinar upon completion of the survey. So, as Igor says, no survey, no CEUs. So, without further ado, I would like to have Dr. Desiree Backman take it away.
Thank you, Elise, and welcome everyone. There's my collaborator, Dr. Neal Kohatsu. We're very pleased to be with you today to present Growing Our Green Infrastructure to Improve Population Health. Next slide, please. Dr. Kohatsu and I are going to divide the presentation into several key areas. We're going to start by setting the context and providing a background of our current health status in the midst of a pandemic. And then we're going to switch gears and talk a bit about the vastly growing scientific literature that is linking greening and health. We're then going to describe a couple of atypical case studies, one with a developer in Northern California who is taking a keen interest in developing healthy communities and is considering the green infrastructure as part of that vision. And then we're going to talk a bit about a study that we're doing right now. It's called Family, and it's designed to reduce the risk of obesity among low-income women, and it includes a tree planting and stewardship campaign. So we want to talk about that a little bit. And then share a bit of insight about creating partnerships to advance greening and health with the healthcare sector and the public health sector, and how that can marry well with the work that you all do as well. And then we'll have plenty of time for discussion. Next slide, please. Before we get started into the meat and potatoes of our presentation, we want to thank our financial supporters, CAL FIRE and the Supplemental Nutrition Assistance Program, who supported us in our efforts today. So next slide, please. I'd like to turn the conversation over to my collaborator, Dr. Neal Kohatsu, to share a bit about background and context setting for health. Neal?
Thank you, Desiree. In the next slide, maybe we could start with some context regarding population health over the past year. As you know, the country has passed a grim milestone with more than 500,000 deaths attributed to COVID-19, the pandemic. Less well known is the fact that overall morbidity and mortality in the US is significantly elevated beyond that due to COVID-19. The pandemic has really served to remind us, medical professionals and the general public, that health extends well beyond hospitals, clinics, and healthcare. In fact, 80 to 90% of health is determined by lifestyle, the environment, and other non-medical factors. So it's really now is an important time to think about a green prescription for health. So let me turn the program back to Dr. Backman to share a little bit about what we know regarding greening and health. Desiree?
Thank you, Neal. Next slide, please. So this is a great time to be doing what we all love to do, to grow our green infrastructure, to grow our canopy throughout our state and in states across the country, because the science is getting better and better, and it's getting more rich by the moment. Next slide, please. So this next slide really shows the common suspects of what trees and our green infrastructure can do. And this scientific basis has been around for a considerable amount of time. We know that trees improve our air and water quality, that they help to mitigate the heat island effect and reduce our energy use. They shield us from the harmful rays of the sun and can help alleviate noise, improve our property values in commerce, and provide much needed habitat for our wildlife. This is very well established. In fact, this science is so well established that there's been great work looking at monetizing these co-benefits. Next slide, please. But now we're seeing more and more really good science demonstrating this connection between human health and well-being and our green infrastructure. So this particular slide is a summary of a very nice review that was done by Peter James and Associates. And this is looking at the connection or the association between health outcomes and greening. And what this author was able to demonstrate from a vast amount of literature is that there appears to be pretty consistent evidence for a positive association between greening and physical activity. In terms of overweight and obesity, the science is a bit mixed. However, what it is leaning toward is a negative association between greenness and overweight and obesity. That means more greenness, less overweight and obesity. In terms of mental health, there is a growing literature that shows that our green infrastructure has a protective effect on self-reported mental health. And there's been some really good systematic reviews about this very topic. The positive effects appear to be good for kids and adolescents, as well as senior citizens and adults. And some of those benefits include decreased rates of depression, decreased rates of hyperactivity and inattention in children, just less distress overall, and even a decreased rate of Alzheimer's disease. When we think about birth weight and cardiovascular outcomes, as well as mortality, there's good news there as well. There seems to be a positive relationship between greenness and these varied health outcomes. And then when we think about inequalities, it's really a tale of two stories here. We know that in lower income neighborhoods that our green infrastructure is less robust, and sometimes it's nearly missing. However, when green infrastructure comes back into these communities, what we see is that these communities, in terms of their health, benefit even more. So this body of literature here that we're going over is really looking at the association rather than cause and effect, but we'll save that for a little bit later in our presentation. Next slide, please. Dr. Kohatsu and I wanted to highlight a couple of observational studies that we thought you might be very interested in, which helps to demonstrate what we learned from the Peter James review. Next slide, please. So this particular project is a cross-sectional study, and it examines the relationship between neighborhood greening and the burden of chronic disease. The population for the study was very large. It was 250,000 nearly Medicare beneficiaries in Miami-Dade County, Florida. And what these researchers did is they looked at a score of chronic conditions from diabetes, high blood pressure, high cholesterol, heart attack, stroke, dementia, asthma, arthritis, colorectal cancer, and so many other indicators. So this was a pretty robust look at chronic conditions. And what they were able to find among the study population is that those who were living with higher levels of greenness, that was associated with fewer chronic conditions overall, including those that are associated with obesity. Another key point in this study is that the relationship was even stronger among those who live in low-income neighborhoods, which is very much what Peter James noted in his work as well. Next slide, please. And here's just another interesting example. This second paper looked at almost 110,000, again, a really big sample of women who participated in the nurses' health study, and they were tracked for 8 years. So this is a prospective or longitudinal look at the science. And the purpose of the study was to determine whether there was a relationship between neighborhood greening and mortality. And what they did is they looked at different factors that could have contributed to the findings, and they basically controlled for those. So they controlled and adjusted for age, race, ethnicity, smoking status, physical activity, socioeconomic status, and other factors. And what they found is that women in the greenest quintile, they had a 12% lower all-cause mortality rate compared with those in the least green quintile. So another interesting set of findings here, and linking it directly to mortality. And again, this observational study links back to what Peter James and his collaborators found as well. So I'd like to turn the conversation back over to Dr. Kohatsu, because we've been talking about these associations, and you may be thinking, well, where's the cause and effect? Where are those randomized controlled trials that really demonstrate this connection in very concrete terms? So Neal, I'd like to turn it over to you.
Great, so we can take a look at the next slide. So as Dr. Backman mentioned, I'm going to be talking about a couple of randomized controlled trials, which are considered the gold standard in epidemiology for looking at cause and effect. This first study is an interesting one. The purpose was to determine whether interventions to green up vacant lots could improve depression as measured by a standard community screening tool. So there were two types of interventions that were looked at. The first one, greening, involved trash removal, grading of the site, as well as the planting of grass and trees and some shrubs. It also involved placement of a low perimeter fence. The trash cleanup intervention just consisted of trash removal and a little bit of grass mowing. And there was a control condition where no services were delivered. So there were a total of 110 vacant lot clusters, about 540 vacant lots. And within that, there was a random assignment to each of the three conditions: greening, trash cleanup, and control. About 450 residents lived in the neighborhood around these vacant lots. So what's the bottom line? The researchers found that the greening intervention, but interestingly, not the trash cleanup alone, the greening intervention was associated with a decrease in the prevalence of depression. Now, it's interesting to note the whole concept of greening up 100, well, actually hundreds of vacant lots seems daunting, including economically. But what the authors reported was that it cost about $1,600 to green up a vacant lot. And they estimated that the maintenance costs were only about $180 per year. So something that seems feasible in the real world. An interesting side note was that the reduction in depression was actually greater in the neighborhoods below the poverty line. In the next slide, we have two examples of the greening intervention. Each row is an example. So in the two far left pictures, we see the pre-intervention condition. This is what the vacant lots look like before any intervention was begun, and pretty scary. In the middle panels, you see the work to create the greening intervention. And finally, in the pictures on the far right, you see what I would call the creation of mini parks. You can see the low perimeter fence, you can see trees. In some areas, there were some shrubs planted as well. Let's go to the second study that I'm going to talk about, also a randomized controlled study. This one looked at the impact of community greening on crime and the perception of neighborhood safety. It had a similar design to the previous study, was also done in the same part of Philadelphia. There were 540 vacant lots randomly assigned into two groups, a treatment arm and a control arm. The intervention arm consisted of trash removal, grass and tree planting, as you heard me describe previously, and again, the installation of a low perimeter fence. The control areas, again, received no services. Main result, the greening areas showed reduced fear measured through a standardized questionnaire, enhanced feeling of safety, and a reduction in police reported violent crime. So to put this in context, something like 15% of land in US cities is viewed as vacant or abandoned. These vacant lots, in fact, are crime magnets and is often the site of drug deals. Again, similar finding as the previous study, the reduction in crime was actually greater in neighborhoods below the poverty line. So as Dr. Backman mentioned in the next slide, we'd like to talk about, in this application part of our talk, two case studies. And we can go into the details of the first one in the next slide. So Dr. Backman and I are part of a UC Davis team working with a prominent Northern California developer who's interested in learning how greening can contribute to the value of a large development. This developer, in fact, is funding an evidence-based report on various health topics related to land development, including the role of greening. There are a lot of stakeholders who are interested in this, including governmental land use agencies, home building companies, community members, and area businesses. I think what this pilot talks about, and in the discussion we can go into more depth somewhat, this level of interest and the financial commitment by a developer to exploring greening and health really suggests that there may be some broad opportunities that are evolving to involve business and policy worlds in greening. In fact, we're seeing this not only in the United States, but particularly in Europe as well. So we'd like to talk more about a second case study, and I'm going to turn that discussion over to Dr. Backman. Desiree?
Thank you. Thanks, Neal. So as I mentioned previously, our second case study is about a study that Neal and I and our collaborators are involved in currently. It's called Koa Family. Next slide, please. The aim of our study is to determine the impact of Koa family interventions on reducing overweight and obesity and improving related behavioral and health indicators among low-income, overweight, or obese women in the greater Sacramento region. And the design of our study is a randomized controlled trial, much akin to what Dr. Kohatsu was describing previously. What we're looking to do is to be able to speak to cause and effect of this body of work. We are measuring a variety of indicators, including height and weight, which come together to form the body mass index. And that is an index of how healthy one's weight is, if it's normal weight, overweight, or obese. So we're measuring that. We're measuring a variety of dietary factors, physical activity, quality of life, social cohesion, and other important indicators associated with this work. And we're also doing an economic evaluation to demonstrate cost effectiveness. Talking about this study is really timely because we just launched it. It is now in the field in the greater Sacramento region. We have recruited our women to be part of the study. There are 68 women that are part of the study currently. And we've also done our baseline data collection. We are also going to collect the data that I described at the end of the program, which will be at week 18 of this work. And then at week 26, we're going to come back around and do the same measurement again to determine sort of the longer term follow-up effects of the intervention itself. Next slide, please. So you might be thinking, so what's the intervention? So there's a three-pronged approach that we're taking. And this approach was brought forth from over a year worth of formative research that my colleagues and I did around the state, where we asked folks, women, men, thought leaders around the state, community leaders, such as yourselves, about how to really think about overweight and obesity and this epidemic that we find ourselves in, and really how to stem the tide. How can we move in a positive direction? And we took all the feedback that we received over a year plus of formative research, and that's what you're going to hear about today. So the first arm of our program, or our intervention, is something that we like to call a whole health program. And the way that it's structured is that women, in this case, because they are our research participants, they meet in smaller groups of 5 to 10 women per group, and they have a health coach who we've trained. And what they do is they meet weekly for about 75 minutes or so each week with a health coach, and they learn and experience together a variety of ways to eat a healthier diet and to be more physically active. But it goes beyond that. It's really about building resilience, growing one's mindset, forming healthy relationships, even learning how to sleep better, which is connected to our weight, learning how to cope with life's ups and downs, and then feeling empowered, truly empowered as a woman. But also part of this whole health program is about thinking about how to be part of community transformation. So, the women really learn how to help feel better for themselves and to grow as an individual. But how does that then translate into being part of a family in a healthy way, and helping our kids to and other family members to eat better and be more active and take care of themselves? And then this broader idea of the community. So as part of the whole health program, we're working with an arborist, and she comes and she also involves the participants in learning about trees, and not only about caring for the trees and planting them, but also its relationship to their health. And then ultimately, they are involved in a tree planting and stewardship campaign where we're going to be planting and stewarding with our research participants 200 trees near their neighborhood, so that they can benefit from the co-benefits that Dr. Kohatsu and I have been talking about today. And an additional supplement to this body of work is a social media campaign. And so our women that are part of the study, they receive frequent text messages to connect them to local resources that help to support their continued healthy lifestyles and weight loss. And then also they belong to private Facebook groups. So each of those smaller clusters of women that I described who are part of the Whole Health program, they are also tucked into each private Facebook group so that they can continue the conversation about their healthy lifestyle changes and about tree planting and stewardship over time. And so we're looking forward, once we complete the study and we have our findings, to be able to share what we learn from this body of work. We're going to be continuing this work through September of this year, and then we'll be making heads or tails about what we learn, and we'll be looking forward to sharing what we learn by year's end. Next slide, please. So let's switch gears a bit and talk about implications for research and practice, and also partnership development moving forward, so we can continue to do more of what we love to do to build our beloved green infrastructure. Next slide, please. So, I think the evidence is pretty clear. Dr. Kohatsu and our team, we like to think about urban greening in this way, that we need to continue to plant, we need to continue to grow, we need to continue to sustain our green infrastructure over time. There's obvious health benefits here. The science continues to grow. And as I mentioned at the outset, this is a really exciting time to be doing what we're doing, and for you to be doing all of the mission-based work. It's so important and it's critical to our health and well-being. And then I think as researchers, it's important for us to remain curious about the role that our green infrastructure plays in our health, in the health of our planet and environment, and our communities at large, and our habitat as well. So the science isn't done yet. There's still much more to come, and we're going to continue to explore over time. And that's part of the work that we're doing with Koha Family, is to continue that exploration and the understanding of the relationships that we have with our planet. And next, I'd like to turn it over to Dr. Kohatsu, who's going to provide some, I think, practical advice on how we can better connect our green infrastructure with people whose primary focus it is to improve health and well-being of their communities. Neal?
Well, thanks, Desiree. These are just a few examples of health organizations and entities that I think are really starting to take a broader view of health. Local health departments, for example, really think about making broad connections within the community and like to bring together stakeholders, including those interested in greening, to see how partners can work together to advance population health and individual health as well. Increasingly, we're seeing that foundations, particularly those with a local focus in our area, there are a number of foundations that take a local interest. They're starting to take this broader view of health and not just see it as free clinics, for example. Community clinics, particularly federally qualified health centers, have a mandate to reach out into the community and bring partners together. And we are really developing some productive relationships, again, that go well beyond healthcare and think about the environmental aspects of health. We're working with a clinic, for example, in the Sacramento area that has a very nice community garden, is also working with tree planting groups in our neighboring Yolo County. Not-for-profit hospitals have a community benefit arm that helps to meet their not-for-profit mission and legal responsibilities. They are also looking into the community, looking into the role of environment. And finally, partners that you may not have thought about, those that try and improve low-income housing and food security, they're looking to partner with environmental-based groups, including greening groups, to see how there can be work together to advance health. So those are just a few examples. Let me send it back to Dr. Backman for some closing comments.
All right, next slide, please. You can just see there is so much opportunity here. And I know that each and every one of you and the work that you do, you are already making these really important connections. And what is oftentimes viewed as a atypical relationship becomes very typical with the work that you do to expand and to grow your mission and ultimately be able to increase the tree canopy cover in your respective communities. So the science is really there. Now we just continue to build out the science, get these findings in front of public policymakers, decision makers, potential funders, and continue to use this evidence to demonstrate the connection and to ultimately secure the investment in the continued growth and the future of not only our health, but our beloved tree canopy cover. So those conclude the remarks for me and Dr. Kohatsu, and we're looking forward to a robust discussion a little later on in the program.
Awesome. Thank you both so much, Dr. Backman and Dr. Kohatsu. It was really great hearing all of that. And we're going to let the audience kind of think through and process a little bit. There's going to be plenty of time for questions in a little bit. And so please keep adding those to the Q&A. We're going to let you come up with your questions. And right now, we're going to move on to our next presentation. So building on what we've just heard, we're going to have Ray Tretheway, as I said earlier, the founder and former executive director of the Sacramento Tree Foundation. He's going to share tips for bringing more trees to urban spaces throughout California. And he's unable to be with us this morning live, but he's recorded a 15-minute video for us that's packed with inspiration and ideas. So without further ado, we're going to have Ray take it away.
Good morning, everyone. I'm Ray Tretheway, retired executive director from the Sacramento Tree Foundation. I'm very happy to be with you this morning. I first of all certainly want to thank Canopy for an opportunity to share with you some of my thoughts on the future of urban forest. It's been a lot of fun thinking about this topic, digging through the debris of nearly 4 decades of working with urban forests at the community grassroots level. And I hope you enjoy the talk as much as I've enjoyed putting it together. While my talk is taped this morning, I did have a chance to look at Desiree and Neal's presentation on the importance of green space and tree cover in old neighborhoods. And it was most inspiring. And hopefully my short talk fits hand in glove with theirs. Catherine asked me to share with you my vision for our urban forest, as well as to share my experience in advocating for our urban forest. So on that matter, I have some simple and direct advice on advocacy. It's show up. Show up. Advocacy is showing up at the table. If you are not at the table, I can guarantee you your voice, your experiences, your passion, your view of the future will never be fully presented. No matter how good the intentions of those at the decision-making table, absence of your presence, you will not be fully heard. So showing up, for me, is the first and most important step in successful advocacy. And I know you'll all be good at it. I know you've all done it before. And more than ever before, our urban forest community is being asked to step up and show up. Now, in planning this presentation for my vision of urban forests, it became obvious to me that a vision is not just about the future. So my vision actually began by checking in on what I have learned during my 4 decades at the Sacramento Tree Foundation. And I'd like to share with you these 10 lessons learned. 1, growing the best urban forest is not a one-time opportunity. And this comes from one of my favorite quotes from from all places, the U.S. Forest Service. And that quote reads, "An urban forest program really has no end. It will require the continued commitment of citizens, local tree groups, and the elected officials of this generation and those of the future." Number 2, civic trust and collaborations will build the best urban forest. We all know 90% of California's urban forest is owned and managed by private property owners. So building trusting relationships, long-term relationships, and partnerships are key components to growing and maintaining the best urban forests. Number 3, a healthy urban forest does not happen by chance. Healthy urban forests are the result of a community's collective resolve, to develop and implement policies, ordinances, and best practices based upon evidence-based research, studies, and practical experiences. My number 4 lesson learned is urban tree canopy will not increase by chance. The vast majority of trees in my community have been hand-planted and nurtured. More often than not, I believe the expanse of a community's tree cover is a direct reflection of the community's aspirations and values. Number 5, protect our existing mature tree canopy. This is as important as planting new trees. Today's mature tree canopy is on the front line of ameliorating urban heat islands and polluted air, as well as storing carbon and lowering summer energy consumption levels. Number 6, urban tree canopy must be optimized. The best urban forest is one that is extensive, healthy, and low risk. Number 7, tree canopy must be equitable. The immediacy in ending neighborhood tree canopy inequities ranks highest on my urban forest agenda. My number 8 lesson learned is that urban tree canopy programs have a positive ROI and ROC, return on investment, as well as return on community. The greater the amount of canopy, the greater the health of the trees, the more benefits and services are captured. Number 9, native trees and woodlands are our natural heritage. Protecting existing native trees and planting new ones is one of California's key ecological imperatives. And number 10, and I think one of the foremost ones for our local tree groups, education and engagement. They are the cornerstones of all nonprofit community-based tree groups. As nonprofit organizations, we exist as agents of change, and uniquely, we see what can be and strive to achieve what we can see. So in these 10 building blocks that have guided my thinking of the future of California's urban forest. So from there, I'd like to share with you my preferred future for California's urban forest. And there's 3 key elements that build toward my vision. Number 1, place the highest emphasis on social justice and equity. Certainly, we all know trees do not discriminate in who receives their benefits and services. We need to end the discriminatory practices in all of our policies, programs, and services as soon as we can. Number 2, successfully adapt our urban forest to be climate resilient. Let's ready our urban forest for future generations. Let's ready it today. Number 3, we will strive for peak performing urban forest. Again, by optimizing benefits and services while reducing risk and damages. My vision for a statewide renaissance on the importance and values of trees. This vision is one that excels in social forestry. Social forestry, where A healthy urban forest is recognized as a precious resource, which we depend on for our quality of life, and from which we reap benefits that far exceed the cost, and where all Californians from all regions of the state are enlisted to grow and steward the best urban forests. So this leads to my thoughts on how to play this vision out. You may recall a couple of years ago, Swiss scientists from the Federal Institute of Technology in Zurich captured the world's attention in their recommendation for a worldwide 1 trillion tree planting campaign to combat climate change through carbon sequestration. In their report, they stated it would take several decades to plant and nurture 1 trillion new trees to achieve the capacity for trees to store 830 trillion tons of carbon. The report was very, very clear that the world must also continue to aggressively cut carbon emissions. And the report concluded by stating, and I quote, "This is by far, by thousands of times, the cheapest climate change solution." I'm suggesting that the California urban forest community join the international 1 trillion carbon tree campaign. And here's how we may go about doing it. In 2017, Dr. Greg McPherson estimated 236 million empty tree spaces in California urban and community areas, with a mere 173 million existing trees. At maturity, the successful planting of 236 million trees, we can increase our carbon storage by 136%. It's a small but impactful contribution where every Californian can become involved in the fight for climate readiness. I would suggest our campaign is not for the lighthearted. And to get started, I can share with you 3 key components. One would be a statewide education, communications, and outreach campaign. It would focus on a shared vision for California's urban forest, neighborhood by neighborhood, contributing to fighting climate change. 2, we would have civic, business, nonprofit, and community leadership and regionalism. This leadership would articulate and guide the campaign, its growth and management. And a regional approach is needed to capture California's diverse environments as well as populations. And thirdly, this campaign would have to have science and verification. The campaign validation is so important to have the evidence-based studies to develop the campaign guidelines, the carbon calculation, the monitoring protocols, the baseline measurements to track carbon results, and campaign best practices. Well, I won't leave you at that. I'll go further and I'll share with you my thumbnail sketch on how to achieve our urban forest carbon goals and fill those 236 million empty tree planting spaces. It's a 5-prong approach. 1, we need to increase the carbon storage by mature trees. We need to develop programs and incentives to protect and improve the health and longevity of existing trees. We may extend their lifespans by up to 20%, storing more carbon for a greater length of time. Secondly, mean streets to green streets. This is a 30 million tree goal, which will triple California's street tree inventory from its current 9 million trees to 20 million trees. And we would enlist Caltrans to plant 10 million new trees in their right-of-ways and interchanges. Third arena for planting is in new developments, in new neighborhoods. I estimate that about 6.5 million trees. We would enlist the development community, park and school districts, local government planning departments to design and build all new neighborhoods to maximize canopy covers for their benefits and services. Fourth, I call healthy neighborhoods for all. This is the big part of it, 170 million trees. This would be led by environmental justice and equity guiding principles, where we reforest neighborhoods most in need first, but all neighborhoods will achieve canopy cover of about 35%. And fifth, but not least, I call it Re-Oak California, which is broader than just oak trees. We would have the planting of 30 million native trees. We know that native oaks are one of the largest carbon sequestration, have one of the largest sequestration rates of all tree species. And of course, the overall ecological benefit of native trees to our natural habitat and our natural history and heritage is very important to us. That's 236 million trees. And now is the best time to plant those trees. And so I hope the urban forest community will join the Trillion Tree campaign and play their small but impactful part in making a difference for a better future. As Desiree and Neal have shared, trees are a prescription for better health in so many ways. So let's act now on our children's future and their children's future. Healthy neighborhoods for all. Thank you, Canopy.
All right, awesome. Well, as you all just heard, that was Ray Tretheway, and we're thankful that he was able to record himself for us for our webinar today. So for the rest of our time today, we have time for discussion with our speakers, Dr. Backman and Dr. Kohatsu. So whenever you all are ready, please join me and we'll get started. I've been seeing a lot more questions coming in, so I'm just going to read through some of these and hopefully get one or both of you to share what you think. So the first thing I wanted to mention before we get started is that we had a couple questions about links to the studies that you all talked about. And so we are going to be providing a list of those in our resources that we'll share out with attendees after the webinar. So everyone who wants to go read those papers, we will share the links to those afterward. So first, we have some questions related to the case studies. So one question is, do the studies reviewed in Peter James's work consider the fact that greener neighborhoods may also be wealthier or more privileged, and that would explain health disparities?
That's a great question. And a lot of the studies that are featured there, they control for factors that you just described. So there can be a lot of things that can cause an outcome to be demonstrated. And really good research thinks about those other factors and then controls for them in the modeling, the statistical modeling that they do. So oftentimes some common suspects are age, race, ethnicity, socioeconomic status, whether people smoke or not, because that can have a direct impact on behavioral outcomes and health outcomes, the level of physical activity that people engage in. So these different studies may control for some or all of those factors or even more, but usually as a base, you'll see some level of control around socio-demographic characteristics, including socioeconomic status, race, ethnicity, and age, and gender as well. Neal, I don't know if you'd like to add to that.
Well, that's a great summary, and that's certainly my understanding. SES is essentially always controlled for as an immediate potential confounder. Great question. I just highlight quickly, Elise, that in the 2 randomized controlled trials, an interesting finding that I mentioned is that the impact was actually greater in the lowest income strata. So greening can have a differential and beneficial impact at the lowest income groups in the community.
That's great news. All right, well, thank you. We also had several questions related to the first case study that you mentioned about working with the Northern California developer. And so I'm wondering if you could share a little bit more about that. One specific question was, you know, one of the questions was, what do you think convinced the developer to include greening and health in their project? And was this residential, was it commercial or mixed use, something like this? And then just, do you know if of any cities or counties that are actually requiring prioritizing greening and health in their planning and zoning as it relates to that project?
So maybe Desiree wants to start. Great question again. A little context on how the legal and policy and governmental approach may be shaping the interest of developers. Maybe we can start there, and I can say a little bit about the specifics, but there's an underpinning of being attention to greening in the public policy sphere and governmental sphere. Desiree.
So this particular developer that we featured in the case study, I think they have a progressive view of what their developments may look like in the future. They're asking themselves questions about health and how best to construct their communities to help bring that forward. So I think what they're bringing to the table is leadership and an understanding about how they use their land use plan to maximize the health co-benefits of the people who ultimately are going to be inhabiting the space. And we were encouraged that they reached out to UC Davis to say, okay, we'd like to have a better understanding of what is the real potential here. What role can they play in constructing the community such that the folks who live there have the ability to make it walkable for folks who may have difficulty with mobility? How do they construct it in such a way that it helps with that? But all the while thinking about the broader environmental context in which this development is going to be constructed. So, we do applaud their leadership in thinking ahead of time about how their development may contribute to health, and to be open about all of the different factors that could contribute to it. So, for Dr. Kohatsu and I, of course, one of the things that we wanted to contribute at the outset is a really good scientific understanding of the role that green infrastructure that currently exists on the land, but then how does it get constructed to really maximize those co-benefits? And of course, the developer is open to all of these different factors. So we really saw it as an opportunity to bring forth the science that we talked about today and to bring that to the developer so that they could have this broader vision that's much akin to what Ray Tretheway was talking about as well. Neal?
So I mentioned this briefly, but particularly in Europe, there's an interplay between business developers and government and communities, with the notion that we're starting to see public policy and how land use is approved, that increasingly there are requirements to look at open space has been looked at for a long time, but getting into more of the nuances and thinking about greening, and people, landscape architects and people in government are increasingly becoming very aware of the literature that Desiree and I talked about. So I think there's a back and forth. There's some drivers from government policy, as Desiree mentioned, progressive developers. And in this case, it might skew to the upper income, or thinking about environmental impact, climate change, more natural environments. Everything shouldn't, no offense to the Phoenix area, but everything, a hyper manicured golf type communities. People have gone beyond that, particularly in Northern California, looking for more natural environments. So I think those are some of the exciting areas, and we're seeing it here and in Europe and Australia, other places as well.
I think one other thing to add too is, when the developers are starting to get these connections, they're also thinking about their business model and how do they differentiate their development from their competitors, and how do they use their approaches to, bring people obviously into their community, but how do they really differentiate themselves in the marketplace? So, this could be yet one other driver in their decision making to connect the science with their practice.
Mhm. Wow. Well, that's all really helpful. And is the the developer study, is that going to be published anytime soon?
It's really more of a consultation, but our general point was that the fact that the developer's willing to pay to learn more and put it in context is saying businesses looking for an edge, as Dr. Backman said. So in the fact that they paid for it, they have certain rights and controls, because it's basically a report that was done in consult with their guidance. This is the questions they wanted answered. So, but I think in some form, some of the general findings probably will be shared. So we'll certainly keep Canopy apprised on what we can share from when the work is completed.
That would be great, because I know that in our area there are many occasions where developers are going straight to, there's a developer working with their client and they go straight to the city or county for, to get approval for their plans. And there's not, that's the first entity they're talking to. They're not talking to community leaders about what's going to be the healthiest development for this new apartment complex or something. And so it would be really interesting to find out what kinds of things they might be surprised about, through the research and through community connections. What are things that they wouldn't have designed into their project from the get-go if it weren't for having that specific feedback on how to improve people's health through their development.
And one other thing to add too that we did is we connected the science and some with practice guidelines, and also the general plan for the region in which this development is going to be developed. So we try to take the guesswork out of it as much as possible by connecting parts of the general plan that spoke directly to open space and greening and tree ordinances and the assets that the community, the municipality already has around greening, and pointed directly to those things that would have had an impact in their considerations for the development. So, it was kind of a nice blend of the literature, the science that we talked about today, plus others. And then the practical implementation, design guidelines, and then that meeting up against the general plan and some of the special provisions in there as well to help advance the greening of communities overall.
Mm-hmm.
And just a quick comment to tie in what Ray said, one of his first principles showing up, going to the governmental entities that oversee land use plans and approve them, talking about how they can improve the general plan that Desiree alluded to, having an ongoing dialogue with them, maybe when they're not approving a particular development, but before they are approving developments, I think is a great strategy. So that early engagement and having them think about it. I know there are, because I've seen open calls for public comment on various plans that are mandated in law. But instead of just doing that, using that portal, I would say really trying to develop a rapport with those who make the approvals. They're a key constituency. And as you said, smart developers are thinking about that. But if they want a quicker approval process, if they want the community to support and not merely not object or certainly avoid vociferous objection. The opportunity is to engage and bring stakeholders together. When one doesn't do that, there was an example in Detroit that got national attention, where a well-intentioned effort from the public health community to increase tree planting, but without engaging the community, got put on hold because there was really concern that you didn't talk to us. Where are these trees going? What's this all about? So that's kind of the negative example. Positive example is build these bridges with some of the partners that perhaps haven't been the usual suspects, because they're more open than you would think. That's our experience.
Mm-hmm. Wow. Well, that's really great that there's good examples out there, and we have good examples to learn from of things that went well, and then there's things where, okay, this is a good learning opportunity for everyone. So I am curious, when you talk about having these, working things into general plans and having, I guess one question that comes to mind is, what's the biggest bang for your buck item? Like if you're thinking of like greening for health, what are the things that you tell developers or you tell, leadership that you recommend from the studies you've been doing?
Well, there are a lot of different ways to approach it, and maybe I can take that question a little obliquely. That regardless of the science, I would say, kind of going back to Ray's first principles, to quote Tip O'Neill, who was a former legendary Speaker of the House, all politics is local. That applies to trees, health, healthcare, you name it. So understanding the needs of the particular community. I grew up in Palo Alto, and Palo Alto is different than Los Altos, is different than Mountain View, different than Menlo Park, although they're all kind of grouped together in Silicon Valley. It's critical to engage the partners at the local level or regional level, if it's a county or whatever it is, or multiple counties, in that discussion before the plan is developed. So kind of as how do you get there? I think that is probably one of the most important things to keep in mind. And I'll toss it to Desiree to talk about, okay, when you have that stakeholder meeting, what are some of the things that come to mind? Because that's really her area of expertise. Desiree?
Well, and you asked about the biggest bang for the buck, Elise. I think one of our key messages on these projects, whether it's, with the developer or the Koha family work that we're doing right now, is to really optimize the urban forest and to describe what does that actually mean? What does that look like? And it's helpful to, work in communities where they've already done their inventory, so they know where they are. And then they can benchmark against that and see how they can grow it. What are the opportunities to grow it over time? And I think Ray did such a beautiful job of describing Dr. McPherson's work and understanding what's the potential, what's the opportunity there. And then to get the biggest bang for the buck is to really get those trees established and growing over time in those gap areas. And then also, because there is such inequities and disparities in low-income communities, and we know that, our friends at CAL FIRE are really making a strong investment in those communities statewide, and really filling those gaps. That's a big bang for the buck right there, because there's so much potential. And we know from the literature that the health outcomes associated with that in these communities can be even greater. So, being strategic and thinking about, where are those gaps, filling those gaps, and then, but not neglecting the mature tree canopy, and making sure that there's proper replacement over time. Our work here is, it's not going to be done. It's something that we need to continue to attend to, I think, as Ray pointed out so beautifully.
Mm-hmm.
The other thing I'd say, connected to what Desiree said, is as with most important things, the devil's in the details. It's important to have the expertise of certified arborists and policy experts that are on this call to be there. If you plant the wrong trees, people can get frustrated and say, wow, now, the sidewalk is dangerous, or these limbs present a hazard. They keep coming down in windy conditions. So all those things, of course, experts think about. So getting the expertise of the folks who join these webinars is absolutely critical. But people aren't going to call you necessarily. That's the problem. And that's what I think Ray was saying, is that get a seat at the table and say, you can pick out the right trees. Because I know I saw a question in the chat, well, how do you get the neighborhood preservationists and this and that to, what if there's resistance? And again, there's no easy or magic formula, but when you first listen, what are their fears? Are you going to tear down these trees? Is there a point of common ground? And again, the engagement early on, rather than just at the point of when a project is starting, is really the critical thing. So listening to these other voices is important, but the voice of experts at the table is not always there, as we know. And to some extent, we have to be a little pushy.
And with the example of the Koa family study as just one other example there, we are doing this tree planting and stewardship piece as part of this more global obesity prevention and management approach. And, right away, we got in contact with the Sacramento Tree Foundation to coordinate our efforts, making sure that we have, the right trees in the right place. We have engaged a certified arborist and master gardener, Ann Fankner, which some of you may know. She's with Davie Resource Group, and she's working directly with our participants. So we've got the experts at the table so that the women who are in our study, they get the very best of the best, so that as they're learning and developing that environmental ethos, then that can translate into not only what they learn and do, but also what their families learn and do, and the broader community learns and does over time. And so we made that investment up front to make sure that we are doing it right, and that our research participants are getting the very best information that they can moving forward.
Mm-hmm. Thank you. Those are all really great points. I have a couple of shorter questions to get out there. So one at the very beginning was if you could define the Koa family interventions. And I think that might mean, like, what even is Koa family intervention?
Yes. So a little bit about the term. We get that question a lot. It's like, what's that name all about? So when we were doing our formative research, we asked women throughout the state about what the name of this project should be. And we had a local marketing and design firm work with us to come up with a bunch of candidate names. And they were very kind of straightforward, a little bit boring, I have to admit, names. And Dr. Kohatsu and his family, they are originally from Hawaii. And so we kind of got inspired, our marketing team got inspired by a variety of Hawaiian words. And one of them was koa. And of course, there's the koa tree that you know about. But koa is a Hawaiian word that means brave, courageous, and just in all of the different locations where we did this formative research, women were really gravitating to that because they, and in their own words, they would describe sort of bravely facing each day, whether they're, a single woman or a mother or a caregiver to someone, an employee, all the different hats that we play in society. The idea of this word koa really resonated with people. And we knew really early on that needed to be part of the name. And then it kind of went from there. It's like, well, Koa family, they sort of saw themselves as whether it's their own family with their children or their parents or other family members, family as community. And the two things came together. And when we pulled them together, they're like, that's it. That's what we want it to be called. So that is the base of the name. And, you know, in a bigger scheme of things, the intervention is really about building community. It's about building micro communities of women who get together to support one another in, you know, tackling what life has to present to lead a wholehearted life, mind, body, and spirit. And it just so happens that one of the outcomes of this work is weight loss and better diets, better physical activity, and of course, more trees in low-income communities.
Wow.
You know, Elise, I just add, there is no substitute for actually asking the community what they think. I thought COA would be the last choice, like how is that going to relate? And as Desiree related, it related beautifully. And although we use the English word family, the concept of ohana in Hawaiian culture is very important. So it was key to asking the community what words resonated with them, and I was surprised, pleasantly surprised on how it's worked out so well.
So is that program something that you're planning to replicate in the same area or expand? I'm curious a little bit if you have any thoughts on the future for that, because there might be people like me who are like, wow, that sounds amazing. There's probably plenty of people in other places that would want to participate in something like that.
Yeah, so our goal is to you know, do this research and learn and see what we find from it, and really take those positive learnings and the positive parts of the work that we're doing that are effective, and then determine, you know, the best way to translate that over time. The interesting benefit of trying to do this work in the midst of a pandemic, and it's really hard, and we know how hard it is for the work that you're all doing, socially distanced and not being able to have people gather. But an interesting odd benefit that sort of came from all of this is our ability to do this program virtually. So we're using Zoom. This is kind of the gathering place for the women in our study, maximizing social media for good with these private Facebook groups where the women can continue to be in community and to share their life experience and share their successes and challenges. So how to use kind of in the technological age, how do we use this in a way, these platforms, to do more of this work? On the back end of things, I think it's going to help us to make interventions like, and this program called Koa Family, more available to more people, because you don't actually have to physically gather. We're also, as we're thinking about and preparing for the tree planting and stewardship part of this, you know, the ladies learn about it using Zoom from our certified arborist, and then the tree planting itself, you know, depending upon where we are with public health guidance, we can use, you know, streaming videos, so it helps them to feel like they're there. Or we can do something where there is some social distancing. So we're just kind of playing it by ear, but the technology has been an interesting, I think, side benefit right now.
Wow, well, that's really great that there's so much that you've been able to do through technology, even when things were hard, and it sounds really great, like I said. So there are a few more questions. Hopefully we can get through a few more before we've got to sign off today. There was a really good question early on. Someone asked if you included the homeless component in your research, and if there's an impact on that community.
That's a great question. So the unsheltered population is not part of our study currently. So the Koa family study is for women, but they are sheltered in some shape, way, or form as part of the study. They needed to have access to be able to plug into Zoom. And most of them do that through their cell phone. We have a few participants who needed tablets, and so we were able to furnish those as part of the study. They also have to weigh themselves, and we've got this really great technology that's used by UC Davis, where the participants each have a scale, and when they step on that scale, that data goes into a research computer, so it's transmitted, so they don't even have to keep track of their weight. So there were certain things that the participants needed to be able to do to participate in the study. And I'd like to turn it over to Neal. Do you have any more to add about that?
No, those were kind of the limitations that we had to focus in on a subset of the population.
Okay, that's great. For your studies that you've gone through and that you're all very knowledgeable about, have food forests been something that you've worked on very much? And I'm just curious if you could say a little bit about using and food forest. I mean, maybe fruit trees, other, nut trees, and all kinds of. There's maybe even you've integrated like regular plantings, like little farm style. I'm wondering if those are particularly have brought about any particular findings for you.
Yes,
Desiree?
sure. So yes, food-bearing trees are part of the mix in Koa family. And so we actually started this study before the pandemic, right before the pandemic and shelter in place last year. And then of course the shutdown happened. So that had an effect. But one of the things that we had done ahead of time is Neal had mentioned local federally qualified health center in our region, and they have a kind of a produce prescription type program, and they were building a community garden. So we had worked with them in what we like to call the Koa Family Study 1.0. We're now in the 2.0. They wanted fruit trees as part of their community garden. And so that is part of the mix. And in any of our research participants would like to have a food-bearing tree, fruit tree as one example, that is part of it. If any of our local partners who are allowing us to plant and steward trees on their property, on public land as an example, if fruit trees can be part of that mix, we're certainly right there to offer it. So it's a good question.
Oh, sorry.
Go ahead, Neal.
Sorry, Desiree. The only thing I'd add is, and it's not my area of expertise, but in doing this large review for the developer, ran across some scientific literature. When you go to academic environmental health experts who focus on greening and health and landscape architects primarily in academia and some in practice, they're starting to write exactly about that greening also includes fruit-bearing trees, blueberry bushes, and the like. Food producing aspects of greenery is starting to be thought about in a formal way. So I'm glad the person asked the question, because it's really a topic right now.
Mm-hmm.
Mm-hmm. And what about cases, kind of coming back a little bit more to the earlier discussion about the developers, when a lot of times we're seeing lots of urban redevelopment. And so it's not just some empty field that we're turning into something, it's a building torn down to create, build a new building. And what comes out green-wise and what goes back in isn't always equal. We know this. And so there's often, lots of discussion in our area in particular, about mature trees being lost and maybe a bunch of little ones put back in. And we heard earlier a little bit about, the health benefits of mature trees. So I'm curious if there's anything you would want to share about that concept, that in your research or in your work, you found health benefits of mature trees able to be communicated in a way that this now affects the way that, the land is being redeveloped in our areas.
Desiree?
Yeah, so, I think that is all part and parcel of the conversation. So let's just take our Koa family study as one example. So when we are talking to our local partners who are going to allow the tree plantings especially on public land, we see part of our job is being able to paint that picture with our partners. So it can't be that, we're going to just plant small trees. So we've had to do a lot of education, because the idea, we've got partners that say, yes, we'd like to have trees, but we kind of want to do it this way. This is where our arborist expert comes into play, Ann Fankner. She's able to talk about how to get the most benefits for health, for energy savings, for the broader landscape. And sometimes folks are like, yeah, but we still want the smaller trees. And it means like, okay, so we're just going to have to spend a little more time here to try to find that win-win, because, they want to have a win and we want to get the most benefits. And typically our partners do too. So sometimes it just takes a while for them to get the proper education, to be able to have this vision of what their area could actually look like. And at the end of the day, get to that win-win all the way around. So we just try to make that investment up front, having those connections with our partners and being able to cultivate the relationship in an authentic way, but also being clear about, how to get to the greatest benefit possible is really key. And sometimes, as you described, Elise, it's not an easy path to get there, but we just are really committed to staying on that path.
Sure, that's great. And I have one more question for you both before we end today. And it relates to, getting this stuff done, funding this kind of stuff. You mentioned, Desiree, that CAL FIRE is making an investment in low income communities. And is there a program, or are there particular grants that relate to the work you all are doing that are available that people can try to tap into? And, what are usually the timeframes for those types of things?
Yeah, so they vary. I would stay posted on the urban forestry area, the portion of the CAL FIRE website. Another great resource to connect to is California Relief, the state level advocacy group for trees, and stay connected to their website. You can also, connect with Cindy Blaine and her crew there at California Relief. They're really on the pulse of what's going on funding wise, funding cycles. They also offer pass-through grants, in large part that come through CAL FIRE. So they're a super kind of a one-stop shop resource to stay on the pulse of what is emerging. Another cool feature about California Relief is that you can really get close in on the type of advocacy work that they're doing at the Capitol and stay on the pulse of what's going on policy-wise, so that you kind of stay clear on the type of funding that may be becoming available in the future through different bond measures or other pieces of legislation that they're advocating for. And then I guess one other piece, like for Koa family as an example, it seems, at least at first blush from people that we talk to, it's like, well, that's kind of interesting. It's CAL FIRE, and then it's USDA Supplemental Nutrition Assistance Program, which is the food stamp program. So I think, the reason why that came together is that we created a bridge for that to come together and had the vision for a project like this. And so, when Dr. Kohatsu was talking a bit about how to connect with the health communities, And I see this so much with the local nonprofits in the tree world. They're doing an amazing job of being that bridge, of actually connecting these funding sources that may not necessarily dance together. Sometimes they don't even know about each other. And you're the conduit to create that bridge for, these different funding streams to come together, to benefit the community and benefit the growth of our urban forest.
Mhm.
The only thing I'd add, Elise, is we talked about it, is reach out to community benefit managers at the various public hospitals in your particular area. Reach out to local foundations, and by local, I mean there are national grants one can apply to. They're hard to get and take a long time, Robert Wood Johnson. But when I mean local foundations, in our area, it's the Sierra Health Foundation, which focuses on the area, Sacramento, northward. I know that's outside of the Bay Area, but you can look at the website to see what kind of work they do, and many other foundations, including those based in the Bay Area and Southern California, are similarly moving in that direction. So those are other sources of funding. And then increasingly, going back to what Desiree said, there's a business model that's evolving, particularly in areas like the Bay Area, Sacramento, more progressive areas, that are looking to see how can we explore that. As I said, the project that the developer is funding. So really go to folks that you might be surprised have an interest and make a pitch.
Mhm. Well, that's great advice. And just this whole session was so wonderful. Thank you both so much again for your time today, for answering our questions, and for your wonderful presentation. So now we're going to switch over to a couple of slides. So thank you both.
Thank you, Elise.
Thank
And
you.
Natalie is going to bring up a couple of slides, just a couple of reminders for y'all before you sign off today. Just thank you all to our guests, and we will provide the answers to the remaining questions later today. So look for a follow-up email with that information. For those of you who had great questions, we hope to still answer them. And this is a reminder to sign up for Canopy's next webinar on April 29th to learn about Google Ecology's science-based collaborative approach to restoring ecological functions of the landscape, as well as public resources available for similar projects in the region. And finally, we would like to announce that Canopy is seeking candidates for the tree program's senior manager position. This person will be responsible for overseeing all of Canopy's tree programs, which include tree planting, tree care, surveying, and some education and advocacy work. Please visit the Canopy website, canopy.org, to read the full job description and pass along the message if you can. And just a reminder, when you exit the webinar, you'll be prompted to fill out our survey. Please do that. We really appreciate it. And ISA Certified Arborist, you will get your CEU code for this webinar when you complete the survey. So no survey, no CEUs. And we thank you for your time today and hope you have a wonderful rest of your day.